this talk is focusing on how Turkey transformed itself from a fractured system that had multiple payers and multiple health delivery systems into a single payer universal healthcare system. And my personal connection to Turkey is I lived there for over 20 years and I taught in a university, art college, the Fine Arts Academy there for the whole time that I was in Turkey. And because it was a public institution, I was covered under health insurance. So when I moved to the United States to help take care of my mom, it didn't even occur to me to get health insurance. Because I was like, well, why would I? Am I covered? I'd been living in Turkey for all these years. And it wasn't until my sister finally said to me, what? You don't have health insurance? I was like, no, am I covered? And my mom in her demented state said, don't forget, she's lived most of her lives in countries, because I spent most of my life growing up overseas, in countries that actually offered universal health care. So I wasn't thinking that health care was an issue. I just wasn't thinking that. So uh, I start working and I paid about $5,000 a year for health insurance with Molina. My sister in the interim dies of colon cancer. They denied me getting a colonoscopy 3 times, and when they finally approved my colonoscopy, I ended up paying $3,000 for the colonoscopy because while they'll pay for the medical procedure of the tube, they don't pay for the removal of the polyps, for the biopsy of the polyps, for the bed, for the medicine that you take when you get put out, for your slippers, for the hospital fees. They don't cover. Molina Health Insurance didn't cover any of that. So I ended up covering that. Because I have dense breasts, I had to go for this very fancy breast imaging. They cost me about $1,000, $300 for labs, and then just like denial after denial for my back stuff. And I was like, this is insane. What am I paying $5,000 for? Let me go to Turkey. So I just went to Turkey this summer and I paid $230. That is not a typo. That's not 2,300. That's $230 for 3 X-rays, 3 MRIs, and 2 doctor's visits in the best spinal clinic in Turkey. So my question is, why can a country like Turkey that has a per capita income of about 10K provide single payer universal health care and the US can't? And this is how they did it. So just a really brief background about Turkey. It was founded in 23. It was the sick man of Europe. It had always been an empire. It was the before it was the Ottoman Empire, it was the Byzantine Empire. Um, in 23, Ataturk founded the Republic. In 45, they finally got their shit together enough that they started thinking about, oh yeah, maybe we should offer some sort of health insurance. It took another 20 years for them to put health insurance into a 5-year plan, but it was aspirational only. It was never implemented. In the 80s, Turkey went through a series of military coups. And one of the outcomes of the military coup, interestingly enough, was a new constitution which guaranteed the right of health insurance and health services. In 87, the military coup constitution was changed to a civic constitution, and we have a basic health law that says that healthcare is a human right in Turkey. It's been on the books since 87 and it was never implemented, um, which meant that the poor and the underemployed were really left without health coverage. And in 92, the equivalent, I guess, of our Medicare and Medicaid schemes were implemented to cover those two populations. Um, in 2006, Turkey had a new election and we had a new president come through. His name is Tayyip Erdogan. And he did a couple of really important things. Turkey was very dependent upon the IMF and the IOI for funding for the dams and for all of these infrastructure projects. And under Tayyip, Turkey was able to pay off their huge loans to the IMF. And all of a sudden they had money. And I think it was about 32 or 34% of their GDP was going to these loans. And so all of a sudden in 2006, the loans were paid off and they could start a compulsory single payer health insurance, which is what they did. And they merged these 5 different fractured schemes, none of which were public, they were all private, into one scheme. And they did something else which was really good. They unified all of the hospitals into the Ministry of Health, including a national unified electronic record, which Turkey had when I went there in 1988. They had a national record. They didn't have computers, maybe, but they had a national record. So it didn't matter what city. Um, However, private hospitals and the private insurance framework is still very much alive and serves still to this day about 10% of the population. In 2019, a further centralization happened. Turkey got a big boost in money. All of a sudden, they had even more money, so they could go into things like workforce planning, which Turkey has traditionally been very poor at. And they've spent a lot of time working on vaccines and increasing vaccine uptake in the population. They said they did health research and development, but I've never seen evidence of really great research coming out of Turkey. In 2019, almost 100%, 98.8% of the population is now covered, up from 71 in 2003, and it's dropped down to 9% having private health insurance, which is what we're hoping is going to happen in Washington State when we get our universal health care bill covered, because as as the public share increases, the private, of course, decreases because it's cheaper, right? It's more economically viable. Um, so who's covered? All Turkish citizens are covered. The way that they do it is they take about 16% out of your check. You don't even know that you're being taken that out. And then all businesses pay about another 16%. They have special categories for children, retirees, and the poor. Foreigners who are legally employed, meaning diplomats, people like me who were working in universities or working in public schools as foreigners, multinational corporate employees, those are all covered. What's really interesting about Turkey is how they are dealing with the refugee community. There are about 4 million Syrian refugees in Turkey right now. About 63% of all Syrian refugees globally are being housed in Turkey. And we don't have an exact number, but I've heard over 50% are under 18. So we have a huge swath of minors in Turkey that are in need of primary care and also in need of vaccines. And Turkey has provided free health care to those people, including other official asylum seekers. And this is just a little aside that I think we, as people who are interested in single payer, need to start thinking about, because the United States also has an asylum seeking avenue in our government, and how are we going to, as we implement a universal single payer system, how are we going to think about covering not only refugees who are recognized, but asylum seekers and the forced migrant communities as well. The forced migrant communities in Turkey, unfortunately, are not covered. They have no access to health care. And the way that I got into this actually was because of that. I lived in the slums, because it doesn't matter whether you're an artist in America or whether you're an artist in Turkey, you still don't make enough money to live in the fancy places. So I had a beautiful warehouse building in the slums of Turkey that was built in the 1600s. Um, and I looked out my window, my warehouse window, and I saw these Africans walking up and down the street and they were coughing. And I was like, what the heck is going on with all these Africans? And I found out that this is the area that I lived in was a center for these forced migrants that were coming through Turkey and trying to move on to Europe, many of whom had TB because they came from the 7 countries that are hosting 80% of the TB cases globally. We founded a program over 2 years, going from the Ministry of Health to the Ministry of Police to the equivalent of the Turkish ICE to the jails. And we got legal permission to found a program to test and treat for TB in partnership with the Turkish Anti-TB Association. And at the height of our program, we were testing and treating about 10,000 people a year in 15 different language groups in 9 different cities, until I think in 2000, I left in 2010. I think in 2014, the Turkish government took that program over along with the Turkish Anti-TB Association. And so what are the benefits? The benefits are exactly what they should be. Primary care. They have long-term care, which is kind of interesting. I didn't really think that that was going to happen. I didn't know that that was there actually. Infectious disease, they are very, very strong on infectious disease. They really recognize the importance of HIV and TB and its impact on populations. Chronic diseases are more slowly coming to the forefront. Drug abuse and addiction prevention, childbirth services, emergency and dental, but not vision. And Turkey is a primarily youth population. I think something like 57% of their population are under 45. Um, what are the outcomes of this system? It's nearly universal childhood vaccine rates, including TBs, very low rates of TB and HIV because of free healthcare. All of the drugs are free, including all of those very expensive HIV drugs. They're all free. And they've had an increase in life expectancy equivalent to EU averages now. Um, Maternal and infant mortality rates, and this is, I think, having more to do with the fact that many mothers are still they like going to hospitals that are specialized as opposed to going to their primary care docs. So they don't really, when they're pregnant, they don't really do a very good job of avenuing mothers into primary care. But it has mortality rates have decreased significantly. Um, Very worryingly, there's high rates of anti drug resistance TVs and staffs. So that's a little bit worrying. And the rates of smoking in Turkey are enormous. I was shocked when I went there. The leading risk factors of death in Turkey are high blood pressure is 24%, and the second one is tobacco use. So this is Turkey's got to get on a tobacco education program. Everybody smoked when I was there. I was shocked. Everybody smoked. Um, so that's painting a pretty rosy picture, but of course, there's still a lot of issues. Turkey has fewer hospital beds per population than most EU countries, which means that there is a wait. And it has some of the lowest levels of nurses and physicians in all of the EU regions, and the regional disparities are huge. There are huge swaths in the eastern Turkey and poverty-struck Kurdish areas of Turkey where there is not a clinic and there is no access to health care. And these are my sources if anybody would like more, and I'm going to stop sharing my screen.
Wow, that was wonderful, Cello. So, any questions? Others, Lynn? Okay.
Yeah, you just mentioned the Kurds. How are they treated in Turkey?
So the Kurdish situation, it depends on who you talk to. The Kurds that have traditionally been in the West, in Istanbul, don't forget Turkey had a Kurdish president, so there's not there's not discrimination because you're Kurdish the same way that there's discrimination in the United States because you're black. What there is definitely discrimination is if you are a village person and you live in the East and you're from those poverty-struck regions of Turkey, and there is definite discrimination against those communities. They're being displaced, they're being internally displaced, and driven out of their traditional homelands, mostly because of the Apos group, the Kurdish fighters that are there.
What about religion? What are the religions in Turkey?
So Turkey is a majority 94% Muslim group, but don't forget that Islam recognizes the three great books. Interestingly enough, I can tell you a fun fact. In 1582, I believe it was Osman, said to the Jews who were being oppressed in the Spanish Inquisition in Spain, come to Turkey, and this is the famous quote, Catherine's loss is our gain. So Turkey has a huge Sephardic community. There have never been any oppression against the Jews. They also, the head of the Greek Orthodox Church is in Turkey because of the Byzantine connection, been there for a long, long time. And there's really no religious discrimination that, I mean, in the 22 years that I was there, I never saw religious discrimination. What's a little bit worrying right now is that there are a lot of tourists that are coming in from Asia. So there are a lot more covered people, and I'm not sure how that's going to impact. And they're buying property and they're becoming Turkish citizens. So I'm not sure how that's going to impact the long-term outcomes in Turkey in terms of women's rights.
Thank you.
Thank
This is
Lydia.
Carla. Oh,
I'll go ahead. We have hands up. Who just spoke?
put our hand up. Okay.
Okay, well, okay, Carla. First it's Lydia, then Chris, Cheryl, and Carla.
Okay, Cello, thank you for sharing your story with us. We appreciate it. I have a couple of questions for you. You shared that the cost in the US you were suffering with no services, and then you went to Turkey. Was it totally free, did you say, for you?
No, I paid 200 big. If I see, this was because I'm stupid. If I had been paying the whole time that I was in the States, if I had been paying into the Turkish Social Security system, I would have access to free healthcare because I would have had over 30 years of payment into the healthcare system. But I'm just under the border. So therefore, I'm being treated as a foreigner, even though I paid 20 years into the healthcare system.
Okay, so you had to pay some.
Yeah, I had to pay $230.
Okay, and then what about people who don't work and is everyone covered?
If you are a Turkish citizen and you have had a history of paying into the Turkish Social Security system, you are 100% covered. If you are poor, you're 100% covered. If you're a retiree, you're 100% covered. So they have the equivalent of our Medicare and Medicaid.
What about the migrants?
So the migrant situation, I can talk all day about this. So just tell me to shut up if I'm talking too much, okay? So the asylum process in Turkey is complex. While Turkey is a signatory to the UNHCR and was one of the first signatories to the International Human Declaration of Human Rights, International Declaration of Human Rights, Turkey never signed the geographical limitations, the lifting of the geographical limitations, which means that status determination in Turkey, if you are from a European country like Bosnia Herzegovina, is done by Turkey. But if you are a refugee from Somalia, it is done by the UNHCR. So UNHCR has offices all throughout Turkey that do status determination, and you come in as an asylum seeker and you announce yourself at the port or the police station that you want to be an asylum seeker. And before, they didn't used to jail you, they just used to let you free, but now they actually jail you and they take you to these what are called designated cities, and they're not really jails, but they're cities where you are given oturmak, where you're given permission to stay in only in that city. And if you travel to Ankara for your interview, you have to give them a heads up and tell them what you're doing, because they're just trying to control. I mean, I kind of get it, but it's kind of, I'm not really for this of putting asylum seekers into any kind of prison system or controlled system, camps.
So they really can't move around freely.
They cannot move around freely. Once you are in these cities, it's not like you're not in a walled camp or anything, but you are in that city and you're not really allowed to leave. But when you are in that city, once you have your oturmak, once you have permission to stay in that city, you have free access to health care. And the way that you get that free access to healthcare is that you have to be an official asylum seeker, which means that you had to have gone to the UNHCR and at least registered and gotten a case number.
Okay, thank you.
And that
Chris,
process can take, hang on, I'm sorry, because I can talk about
ahead.
this all day. So really tell me to shut up. But that process, while it sounds very simple, that process can take up to 20 years.
Oh,
Whoa, wow.
Sounds like the
Chris,
US.
Yeah.
Chris, you're up.
So is the only funding for this program a 16% payroll deduction?
So the funding for this program is I think it was, give me 1 second, Chris, I'll tell you this. I have it. I'm just gonna put down my screen because I can't see my other thing. It was I can't find it. Damn it, I can't get, how do I make this escape? Oh, there it is. Okay. Chris, something like, give me 1 minute and I will tell you because I just had it. 37% of their GDP is health expenses. Oh, here
Hmm.
it is. Here it is. Okay. So I'm sorry, this is exactly what I was looking for. This is these numbers are from 2009 and this is from the WHO. So the way that they're funding it since 2010, public sources have accounted for around 78% of the current health expenditures. So it's mostly been publicly funded.
Well, I don't know what that means.
Government,
So it's from taxes. Where's
it's
the
from
in?
taxes.
Okay, so there's a tax in addition to a payroll deduction.
Well, for the Turkish citizen, the Turkish citizen doesn't have a tax because we don't have income tax in Turkey. You get, it's a payroll deduction that's just taken out of about 16%. That's taken out of your thing and that's taken out of your paycheck. And I do not know, and I do know that about 17% is taken out of your employers. Right off the top, I do not know how the internal funding in the Turkish government, how they designate dollars within the Turkish government to pay for their health care. I do know that all of the doctors, nurses, janitors, tea person, they are all public employees, so they all get a public employee's salary.
Cheryl. Yeah, have to unmute. There
Right.
you go.
Okay. Could you talk about first, the question about the rural urban divide in terms of healthcare and use of healthcare? And it sounds like one reason the system works as well as it does is that it's fairly underused. And you already have a scarcity there of docs and nurses. How's that going to work out?
It's in rural many parts of Turkey that are rural to this day. I mean, I haven't been to rural Turkey since 2010, since I left, but I'd spent a lot of time traveling in the east of Turkey. There has been a civil war in Turkey in the east since the 80s, which has decimated that area. We have millions and millions of internally displaced people that have been shuffled off into the cities. When you go to the east, you just see village after village after village that's empty, like literally empty. There's nothing
Mhm.
there. I have friends who are Kurds who are now in their 40s who never had access to school because there was a war going on.
Yeah.
You know,
Mhm.
their whole life there was a war going on. Um, the I'm not sure what's going to happen now. What I do know is that in the Aegean region of Turkey, Turkey is divided into these health regional health. I get regional health geographies. I don't know what we call them, but there's the there's the Aegean, which is going from Istanbul all the way down to the Syrian border on the other side. That area is relatively wealthy because of the amount of tourism that's in there. And I do know for a fact, because I have seen them, very, very small rural villages will have a health clinic. And the way that the health clinic works is very much similar to Mexico, where they have traveling doctors who go from place to place to place. And they do have, every region has within a 1 or 2 hour bus ride, a stage 2 medical facility.
Hmm.
So either access to a hospital for cancer treatments or for operations and surgery. And the larger hospitals, unfortunately, if you were sick with not with cancers, I'm sorry, for broken bones and emergencies, birth, childbirth, etc. If you have cancers and you need like chronic, if you have cancer, there's not very many places where you can go get chemotherapy. You have to travel for that. And
Thank you.
what they did do, because they recognized that primary care was being underutilized, so they did something which I don't know, and I'd be interested in hearing everybody's thoughts on this. What they did was they said, okay, if you're going to go to your primary care physician, we're not going to have any copay at all. We're not going to, it's going to be completely free. But if you go to an emergency ward for something that you could be going for your primary health condition, primary health practitioner for, you're going to pay a little bit. You're going to pay something out of pocket. And that incentive has motivated people to stop using the emergency room and start using their primary care doctors.
Good. Carla,
Okay, I'll make it quick. I'll keep it on the healthcare because I was a tourist in Turkey and I really liked it. But so I'm very interested in all of this. But I also lived in Holland for many years back in the 70s. And I remember when many Turkish folks were coming to Holland and they were living in pretty nice, not so nice places. And now that country is feeling the effects of that. But that's a different thing. My question, I got so many, but you talked about a shortage of doctors and nurses and several. Is there any way that they can get some from Cuba? Is there, I mean, Cuba seems to be the exporter of doctors. I
So
just
really interesting what they're doing now is doctors from Ghana, doctors from Kenya, doctors from India. They're allowing them to come in and kind of doing a fast track for them to be allowed to practice. And I know this specifically for Ghanaians and for Cote d'Ivoire, because people in our community who are French speakers were going to this Cote d'Ivoire doctor who was a refugee, came in as a refugee and was a doctor in Cote d'Ivoire and was able to practice. So
can I
they
say
have been fast tracking.
could I say one more thing about the Kurds? Because
Absolutely.
I went to the Y here out in Woodbury, Minnesota. I don't know if you know where that is, but a Kurdish family did a small smorgasbord for all of us and explained the problems that were over there. And they didn't sound like they were too poverty stricken or uneducated. So it was a take than what you gave me about it was just the poverty folks. Did I miss that?
So yeah, let me clarify what I said then, because the way that I frame it is that it's regional. So the Kurds that live in rural eastern Turkey are of a different face a separate set of problems than Kurdish communities who were born in Istanbul, let's say. Because I mean, I certainly know, I mean, as I said, one of the former presidents of Turkey was Kurdish. So, I mean, there's certainly wealthy Kurds who are doing just fine in Turkey, but the real problems and the real disparities come up because they're internally displaced because of the war.
Okay.
And the war is still continuing to this day. It's been going
Yeah.
on for 40 odd years. It's awful.
Okay, thanks, Lynn.
Who's fighting in Turkey? I'm not up to date on that history.
Um, so the Kurdish movement in Syria are trying to, the Turks see them as trying to grab back the Turkish land. So the Turks have this border, this like demilitarized zone between the Syrian and the Turkish border, which is a pretty big swath of eastern Turkey, where they are in military control of Syrian land. And then since I think since the 70s, Turkey has been waging this low-grade war with horrible repercussions in the east of Turkey against the PKK, which people get labeled PKK, whether they are PKK or not, it is unclear. I will just say that.
Do you see any medical tourism? Do people from the
Oh
States?
yeah. Oh yeah. Oh, I forgot to mention medical tourism. Yeah. Oh, it's really interesting. So when I was there, Um, I was I was in an area of Istanbul, which is right on the Bosphorus, which is filled with very, very fancy homes, extremely wealthy area, filled with people from the EU and people from not the EU, I'm sorry, Oman, Saudi Arabia, and Dubai coming in for facial surgeries, like for lip stuff, for face stuff, for cosmetic surgery is huge in Turkey. Nose jobs, it is enormous. I think what's that called? Cosmetic surgery, like where you do the lips and everything. That's all cosmetic surgery, right? Yeah, I think that it is now the third largest form of medical tourism in Turkey right now. The other thing is that Turks are very strong and they're pushing this with dental. So they're having medical tourism for dental. And in fact, just coincidentally, two of my friends who live right here in Seattle happened to be in Turkey when I was there getting their teeth done because they had major dental issues that they couldn't afford to do here and they were getting them treated in Turkey. And they were paying like $5,000 for the airplane ticket, the hotel, it's a package deal. You go on a beautiful holiday and you get your whatever your surgery done on your teeth, whatever it is.
Well, under single payer, it won't be covering cosmetics, so Turkey might get a lot of
No,
Americans going for surgery.
yeah, foreigners are not covered. If you are a foreigner, you pay. And so there's this, I don't think I made this clear either, and I'm sorry, and thank you for allowing me to clarify it. Turkey, there's a two-tiered medical system. The first is the public system, which is free at point of service, and you have to be a Turkish citizen to access it. Right. And it's a pretty closed system. It's pretty hard as a foreigner to get access to that system even. You have to pay for it if you're going to use it. And I got access to it and I paid for it to use it. The other road is a very thriving road of very, very fancy top tier clinics that people go to. And you can get dental done and you can get your face done and you can get an MRI done and you can get, the docs there go to the Mayo Clinic for their newest whatevers and people, and those are as expensive as the United States, I bet. I didn't even try and go to them because I didn't want to deal with them. But there's a definite two-tiered system. There's the public system and then there's this private system. But as the slide said, it's going down and down and down. Fewer and fewer people are using the private system as the public system is improving.
Great, great. So anybody else have questions for Cello?
And Chris, I will find out how Turkey paid for this because I was looking for that and I couldn't find it. All I could find was the verbiage of public. But I don't know if they got money from the World Bank or if they got money from the European Union or from, I don't know where they got the initial monies from.
What is the biggest source of income for Turkey?
Turkey is the #1 exporter of hazelnuts, oddly enough. It used to have a thriving textile industry. It's all gone over to China, I think. It used to have a thriving leather industry. That's gone over. Interestingly enough, Turkey, all of the military stuff for the Turkish military, Turkish, I think, is the 3rd largest military in the world because every single Turk has to serve. And there's millions and millions of youngsters. I think we have one of the largest standing armies in the EU. They produce all their own weaponry. They produce all their own guns, their tanks,
Excuse
not
me.
their planes, but they produce their
And
tanks and their guns.
can you hear me? Men and women too?
No, men. Oh no, now women are serving. Women are serving
Must
now.
serve, must serve,
Yeah, must serve.
women must serve.
I actually don't quote me on that. I don't know if women must serve. But I know that they just had this thing where a woman was a tank. She was driving a tank. They interviewed her when I was there.
Great. Any other questions? Well, thanks, Cello. This is wonderful. We knew that that people would be thinking about other things tonight, and still we got a good turnout and a lot of good questions. So appreciate you taking your time and wisdom to tell us what's going on in Turkey, and maybe how we can learn from Turkey how to do things better here.
Well, what's
Thank you.
interesting is that they have this dual system and they seem to be able to make it work and manage this dual system and still provide relatively affordable health care for their population.
Well,
Mhm.
16% of a paycheck's pretty hefty tax. Some economists were looking at single payer in the United States, and one suggestion was 3% and 3%, but 16% that's why they have such a good system. Most people in the United States wouldn't allow that that high a tax, unfortunately.
Yeah.
But we pay 32% of our income in taxes. That's not unusual.
Yeah, and if you didn't have any co-pays, deductibles, and premiums, I think it may 16%. I don't know how that would factor out, but I wouldn't be surprised if it was the same or less.
I think it's less. I mean,
Yeah.
people say that, and I always think to myself, well, you know, when I was making money in the United States, I was paying a lot in taxes. I was paying 32% of my salary in taxes. And I was supporting the military industrial complex. I certainly wasn't supporting free healthcare.
Mhm. So Chuck, I see you're here. Do you have a comment for us, Chuck Pinocchio? I don't know if you're, there you go. He was there.
I'm really fascinated, just taking it in, and I want to hear the recording. Unfortunately, I missed the first 20 minutes. I had this in my calendar at 8 o'clock my time, so I had to jump. And anyway, but Cello, thank you so much. I would love to get a personal tour of Turkey at someday with you. And
Let's go.
yeah. Yeah,
Wonderful.
I mean, it's a crossroads between East and West. I mean, Turkey, the Hagia Sophia, is that how you
Yeah,
pronounce it?
Hagia Sophia.
Hagia Sophia. Yeah. I would just love to explore that country. So thank you so much, Chelo, for all you do and for sharing. And let's see if we can get this recording
It
out.
was a deep dive for me. I didn't know anything really about the Turkish medical system, and thanks for One Payer States and Healthcare for All Washington. I actually was like, I knew what questions to ask when I was there, and I could like go to the hospital administrators. I was like, well, how does this work if you're not a citizen? You know? So that's because of the education I've received from you guys.
Yeah,